Hi, I'm Emerson Krieger, and I wanted to talk to you about post-traumatic stress disorder and what it is. I wanted to make this to make sure that we can destigmatize it so that people feel okay about seeking treatment and receiving the help that they need. What is PTSD? PTSD is the abbreviation for post-traumatic stress disorder. This disorder is described by a person having a difficult time recovering after experiencing or witnessing a traumatic event. PTSD can also be caused when someone learns about a family member or friend who has experienced extreme traumas. During a traumatic event, the body will experience a flight or fight response to help during a dangerous situation. Most people recover after a short period of time, but those who continue to have issues can be diagnosed with PTSD. Some examples of people who may experience PTSD include a combat veteran, a sexual assault survivor, someone who survived a natural disaster, a survivor of abuse, or someone who was in a terrible accident. Diagnosis for PTSD. Typically, symptoms of PTSD arise within 3 months of the traumatic event occurring, but in some cases it may emerge later on. In order to get an official diagnosis, a person must present symptoms for longer than 1 month, and these symptoms must be severe enough to interfere with aspects of daily life, such as relationships or work. The symptoms must also be unrelated to medications, substance use, or other illnesses. To be diagnosed with PTSD, an adult must have all of the following for at least 1 month. They must have at least one re-experiencing symptom, at least one avoidance symptom, at least 2 arousal and reactivity symptoms, and at least 2 cognition and mood symptoms. The re-experiencing symptoms are things such as flashbacks, which is reliving the traumatic event, including the physical symptoms such as a racing heart or sweating, reoccurring memories or dreams related to the event that caused the trauma, distressing, harmful thoughts, physical signs of stress. Thoughts and feelings can trigger these symptoms, as can words, objects, or situations that remind them of the event. Avoidance symptoms are staying away from places, events, or objects that remind them of their traumatic experience. Avoiding thoughts or feelings related to the traumatic event to essentially block it out. Avoidance symptoms may cause people to change their routines. For example, some people may avoid being around loud noises, such as fireworks, if they have experienced a trauma within the combat zone. Arousal and reactivity symptoms are things like being easily irritated, feeling tense, on guard, or on edge, having difficulty concentrating, having difficulty falling asleep or staying asleep, feeling irritable or having angry or aggressive outbursts, engaging in risky, reckless, or destructive behavior. Arousal symptoms are often constant, and they can lead to feelings of stress and anger and may interfere with parts of daily life, such as sleeping, eating, or concentrating. Cognition and mood symptoms include things like trouble remembering key features of the traumatic event, negative thoughts about oneself or the world, exaggerated feelings of blame directed towards oneself or others, ongoing negative emotions such as fear, anger, guilt, or shame, loss of interest in previous activities, feelings of social isolation, difficulty feeling positive emotions such as happiness or satisfaction. Cognition and mood symptoms can begin and worsen after the traumatic event. They can lead people to feel detached from friends or family members. Treatment. The most important element of treating PTSD is making sure that you are actively working with a mental health professional who has had some experience treating PTSD. The primary treatments for PTSD that are offered are psychotherapy, medications, or a combination of the both. A mental health professional will help you to find the best course of action and treatment for each patient's specific symptoms and needs. It is important that a trauma-informed approach be used so that survivors can create connections and build a deeper trust. Exposure therapy helps people learn to manage their fear by gradually exposing them in a safe way to the trauma that they have experienced. As part of exposure therapy, people may think or write about the trauma or visit the place where it has happened. This therapy can help people with PTSD reduce symptoms that cause them to distress. Cognitive restructuring helps people make sense of the traumatic event. Sometimes people remember the event differently from how it actually happened, or may feel guilt or shame about something that is not their fault. Cognitive restructuring can help people with PTSD think about what happened in a realistic way. Statistics regarding PTSD. 6 out of every 100 people experience PTSD. Women are more likely to develop it than men. 8% of women and 4% of men will develop PTSD. An estimated 5% of adolescents develop PTSD, and 1.5% had severe impairment. Biological factors such as genes can make people more likely to develop PTSD. It is more common in people who have experienced multiple traumas. First responders like police and firefighters are at a higher risk of developing PTSD due to the work field that they experience. About 1 in 3 of sexual assault survivors develop PTSD. Military veterans are at an extremely high risk of developing PTSD than the general population. Minorities such as African Americans and Hispanics are more likely to experience trauma than white Americans. Minorities are far less likely to receive the treatment, and minorities with PTSD tend to have additional diagnoses such as depression or anxiety. People who live in poverty or are actively experiencing discrimination are more likely to experience PTSD. Trauma that can result in PTSD is also very common amongst the members of the LGBTQ+ community. These people are often treated differently and have stigmas around them that makes it harder for them to want to reach out and receive the help that they need. This is one of the many reasons why outreach programs need to be provided for these at-risk communities so that they can understand what PTSD is and recognize that there is help available to them. Community-based factors. Many people who experience PTSD live in poverty, so their housing is not always stable and they do not have a reliable transportation, which makes it difficult for them to have proper care. This is why it is so important to have a support system that is able to remain in contact with the clients no matter what their housing situation may be. It would also be beneficial to provide transportation or bus passes so that there is one less barrier for these people to receiving treatment. There needs to be an increase in the number of free or low-cost clinics and treatment facilities to allow for a greater level of access to the community. Treatment facilities need to be culturally competent and staff providers that mirror the different races, ethnicities, and sexualities of their clients in order to create a more comfortable and welcoming space for the clients. The harm of the stigma. Some stigmas of PTSD include that a person with PTSD is angry or dangerous, that they can just get over it or need to relax. Don't understand that is a medical condition that can be treated. The person is broken, or it is their own fault that they are experiencing this. People experiencing PTSD often have self-stigma about themselves, such as they are weak, they are worthless, they blame themselves for what happened to them, they feel shame and don't want to discuss their experiences with anyone else. It is vital for both the community and the person with PTSD to understand that it is a medical condition that can be treated. It is important to educate others why PTSD can occur. Empathy should be modeled when educating others. It should be noted that not all people with PTSD have the same symptoms, and to not generalize what one is experiencing since everyone is different. Just like any other mental illness, this is something that is often out of the person's control and can be treated and helped. Awareness needs to be spread so that people understand that PTSD is and how they can be supportive, and people to those experiencing this. Community agency. Mount Carmel Behavioral Health. Mount Carmel Behavioral Health has an inpatient PTSD treatment center in Columbus, Ohio that has a goal of providing you with the care you need to live the healthiest life possible. Mount Carmel has a firm belief in the importance of proper treatments for those with PTSD. They offer a unique treatment for every client they serve, taking into account each individual's needs and goals. The goal of Mount Carmel service is to provide a relatively quick treatment in their inpatient program that will stabilize you enough to release you back out into the public. You will then continue your treatment journey outpatient. After days of individualized, specialized therapies and services, Mount Carmel will help connect you with outside resources to rely on after leaving their program. Mount Carmel has 24-hour services available to those in need, no matter the time, in order to prevent any crises. Thank you so much for listening to what I had to say, and I really hope that we can help destigmatize PTSD and make it a more regular conversation.